My name is Patricia Fernandez, a Nightingale student, here to do my skill video assessment for IV fluid and medication administration. I'm wearing an appropriate school attire with my ID badge visible, no polish, no jewelry. To start things off, my patient will be receiving fluids and medication, or physician order is fluid is to run in 150 ml per hour, and medication order is amoxicillin to 50 milligrams and 100 ml normal saline to infuse in 15 minutes. So I've already calculated the rate based on the drop factor. So both has the same drop factor of 15 drops per ml. Fluid is to run in 38 drops per minute, while the medication is to run 100 drops per minute. Start things off, before administering anything to a patient, you'd want to check physician orders, check for patient identifiers, and check for allergies. Also, you'd want to check for the 6 rights of a medication administration, which are right patient, right medication, right dose, right time, right route, and right documentation. Making sure to cross-check this with the patient's chart, just to be sure. Let's start. So you'd want to perform hand hygiene, provide privacy. I will don gloves. I will also be going through the parts of tubing, IV tubing. So this is the primary line, which has a spike. The spike I'd want to keep sterile until I actually connect it to the bag. This is the drip chamber, so you want to fill it 1/3 to 1/2 full, making sure you're able to see the drops to be able to calculate the rate of the infusion. This is the roller clamp. This is to regulate the drops, so you can either turn it on, turn it off, and like I said, this is what you'll use to be able to regulate the rate. Next, this is the white port. This is where you'd usually be connecting push medications or piggyback, like how we're gonna be doing today. And this is the adapter end, which will be connected to the patient's IV. Next, this is the piggyback tubing. So same, it has a spike, a drip chamber, a clamp, and this is what will be connecting to the white port. So you want to take this off. Just checking. You want to make sure that the roller clamp is off, just so you won't be dripping all over the place. So you want to fill this halfway full, and then hang it. Next is you'll prime the tubing. You'll slowly prime the tubing, making sure that there is no air bubbles. Letting a couple drops of the fluid into the bin. pause it. So to be able to regulate the drops, you'll see the drops coming in, and then you'll count it. So fluid is to run in 38 drops per minute. You'll make sure that there are 38 drops in a minute. So counting in a full minute, making sure that the patient will be receiving it on a correct rate. Drops per minute. For the meantime, let's clamp this off. Now let's prepare the medication. Same thing. Take this off. Making sure it goes all the way in. Making sure again to clamp the roller clamp, filling it halfway. So since this is a piggyback medication, this should be hanging higher than the fluid. Same as what we did with the fluid, we'll be priming this slowly. That off. Slowly prime it, making sure there is no air bubbles. Letting a couple drops come out. Next, we'll be connecting this to the Y port. With the use of an antiseptic swab, you're gonna be a little struggle. There you go. So same. You want to unclamp. Take the cover off. And making sure that the drop rate is correct. Counting every drop in a full minute. Patient is to receive the medication in 100 drops per minute. Full minute. So, obviously the drop for the medication would be faster compared to the drop of the primary line. So the clamp is pulled off. Before leaving the patient, you'd want to check that the IV site is appropriate, leaving the bed on the lowest position with the call bell near the patient. You'd want to clean everything off, discard it to its appropriate bin, and then perform hand hygiene. Come back to check in with the patient.